Well, hello, everybody. We're going to get started on the next talk here. Wonderful to be here. My name is Dr. Myra Altman. I'm a licensed clinical psychologist by training, and I'm the Chief Clinical Officer at Brightline. We're a pediatric mental health provider across all 50 states, providing coaching, digital services, therapy, and psychiatry.
Anybody who's standing in the corner chit-chatting is going to have to answer a round of questions to get us started.
I feel like we need to sing something or, really get it started.
Mama, ooh, Bohemian Rhapsody in here? I don't want to die. Sometimes wish I'd never been born at all. I only sing in the shower, so those of you to bear witness to this, my children would be mortified.
I think it was the perfect introduction. So we have the absolute privilege today of talking a little bit about an incredibly complicated but very important topic around tech and child mental health. So I'm a psychologist. I'm always thinking about mental health. I'm also a new mom, so I have an 11-month-old at home. So this topic has become both professional and personal for me. Do we have any other parents in the audience? Okay. So as we're talking about this, I encourage you to reflect on your life as parents, what your kids are going through, because I think this is a topic that has resonance across so many different levels. So with that, do you want to introduce yourself?
Yeah, Jen Plasse-Puzey. I, like Dr. Altman, have two kids. So I have an 8-year-old and a 5-year-old at home. And very, very recently, we're now in that stage of their development where, technology, I'm starting to fear what they're learning, and they really are truly digital natives. And we recently had parent-teacher conferences. And my 8-year-old, I was talking to her teacher, and she was telling me about an exercise that the class went through, which was to write a letter to their future selves. And she started out to tell me, here are the things that Madison really aspires to in the future. And it was a beautiful exercise. And, the first objective for Madison was, I really want to score that first goal in soccer, which she actually, a week later, did go on to do. So I was very, very excited for her. The second was, I want to be an Olympic gymnast. I thought, okay, that's great. And then the third was, and I really want to be a YouTube star. And I chuckled, and I said to the teacher, oh gosh, I don't know what that says about what we're doing at home, but she does watch a lot of YouTube. And she said, listen, do not be worried. Every single kid in the class wants to be a YouTube star. And I was like, well, actually, maybe we should all be worrying. And I guess by show of hands, any of you in the audience, have you aspired to be a YouTube star? Is that anything you were thinking about?
I think you could be, based on your singing.
Oh, yeah. We have. So, there's this paradox that we have here with technology, which is both the role that it has to play in how our children are developing and receiving the world around them, to I think we have an opportunity. And so, Myra, what are some of the ways in which technology can play a more healthy impact?
Well, I think the first thing we have to think about, we are all at a Going Digital conference. I'm assuming all of us are believers in the role technology can play to help improve health. But I think before we get to that, we have to really spend time and acknowledge the ways that it can hurt people's health. And I think YouTube stardom, not included, we've seen lots of data about how social media use can really harm mental health, particularly for our teen girls. We've seen alarming statistics about the rise in mental health concern among youths. The one that stands out to me most recently is 20% of teens have seriously considered suicide. That is a very scary statistic as a professional in the field, as a parent. And so I think we have to think about the role technology is playing in making mental health worse. And unless we acknowledge that, we can't really think about the role technology can play to help. And I was just in the exhibition hall earlier, and this felt really true to me. Someone said, well, how many monthly active users does Brightline have? And I had to say, like, that's actually not the metric that we think about and care about, because I don't necessarily believe that a kid being on Brightline's app with our beautiful, incredible evidence-based content, that's going to make their life better, right? Like, it's a very different goal for technology. How do we understand what brings people there? How do we help get them better? And the goal then is, how do you go out and live a rich, full, meaningful life and embrace all the chaos and joys that it brings? But I think it takes a really radical shift from the standard metrics that are used in technology to something quite different, to say, what is the meaningful role that technology can play in helping? And I think there's many ways, right? The first that comes to mind for me is access. I think that's probably the first that comes to mind to many people. We provide services to kids, so I think about a parent who is trying to find services for their kid. You don't know what you're looking for, you don't know where to go, and then you don't know how to get there, and maybe you find a therapist and you're driving 30 minutes to and from the appointment. That's really complicated and that's really hard, and so I think technology has a great role to play in saying, let's make it really easy to know what you might need, let's make it really easy to find a therapist, and then you could even do that session online in the comfort of your own home without your commute. So I think the first thing that comes to mind to me, Jen, is the role technology can play in easing access and making things convenient.
Yeah, and I think, like, we have a lot of innovators in this room, and when we think about access at the macro level, we all have a role to play in that, because chances are, whether we're talking about a member or a consumer or the person who needs the care, they might not know where to start. And so, we really have to be able to meet people where they are, and that might be, well, gee, the trust I place is going to be in my provider, or the place I'm going to go is to my health plan, because I know that they're going to provide benefits coverage, and I want to make sure that it's affordable care. And so, wherever they're entering, we really need to do that job of using technology to navigate them and route them based on what is it they're really needing. And then I'd say that's like when people are in need. Hopefully they're not in crisis, but that happens too, which is how do we also use the power of prediction so that we hit them before they even have the need.
I think that's such an important point, Jen, because we probably all heard the stats about there not being enough mental health providers. When we think then about what's considered almost a specialty of youth mental health, that becomes an even more tricky picture of there just aren't enough providers out there, and this mentality of every person needs a therapist and that's the only option. We just know that that's not going to meet the level of need. And so exactly to your point of how do we better understand what people need so we can make better use of the resources. So the way that we do that is we use validated questionnaires, and we try to get a sense of, like, what is your level of risk here? Do you need to really go straight to a therapist? Let's get you there as quickly as possible. Would coaching be a really good fit for you to build skills and develop, those tools early on that then can help prevent things from happening later on?
And on the health plan side, we really are investing a lot of focus on that prediction for high risk, and how do we reach out to get, especially for youth and adolescents, just given the statistic you shared earlier, that help as soon as possible, and having partners like a Brightline to be able to match them with is that's important.
Yeah, and I think so. Who has thought of access as a good benefit of technology? Yes? Okay. Preaching to the choir here. The other thing, as Jen and I were prepping for this, that we were thinking a lot about is the role of technology for quality, which I think is sort of the next frontier of where technology can be helpful. And I started this with that statistic about suicide. We know, fortunately, that there are some really good evidence-based interventions that can help prevent suicide. So safety planning is one. You work with the child, the adolescent, the adult, and you come up with a plan of what will I do if I have these thoughts? What will I do if I don't think I can keep myself safe? And you have very clear, who am I going to call? What am I going to do? This can be really, really effective, and it is very rarely done in general care. And I think what is really interesting and cool about technology is you can just standardize that. Instead of the clinician having to think about, do I do a risk assessment? Did I do a risk assessment? What was their risk before? Or more likely not even thinking about it at all, you make it a standard part of the workflow. And you just put it in at beginning of an intake, you do this. You follow up, you check in on it, and really take that burden off the clinicians of having to remember and having to think through that. And there's like a standardization and a quality control that can happen there. that frankly I think is far beyond what happens in standard clinical practice and has the benefit of also helping the clinician, right? Like there's a lot of tensions between technology and clinicians, and well, you know, we can talk more about that later on, but this is a place where I think clinicians then have a huge sense of relief of like, my first responsibility to this patient is to keep them safe. If there's technology that can help me keep them safe, like that is a win for the clinician as well. I'm curious, Jen, how you all think about that quality piece and the role technology can play there.
Yeah, I mean, we, you know, as we're evolving that story around how we're getting people routed to available care, we want to make sure that it's proven quality care, that we can with confidence get somebody the help that they need, and then can demonstrate that it was quality. You know, I'm sure you guys have all heard of, you know, the notion of ghost network or apparitional network, which basically says like you have great access, but when it comes to need, are the providers available to see patients? So being able to know where that availability is, and that you can actually demonstrate and improve the quality. And I think from the last 5 or 10 minutes, the talk here before was around value-based care, evidence-based care. I mean, that really is the way in which you advance, especially given the supply and demand challenges that are existing within mental health.
Yeah, and I think there's a crucial piece there to, like, how you solve access is by having access to the data, right? Like traditionally it was you have your list of providers, you hope they have openings. I've done this exercise many times more professionally, but perhaps you all have done this personally where you call the list and you see who has availability. That in and of itself takes a huge amount of time. In my case, I called 50 providers. 2 called me back to say, I'm so sorry, I have no openings. Like most people are not gonna make it through those 50 calls. But how do you actually guarantee access if you don't have data about when providers are available, right? Like how many spots do you have open? When are those spots? Are they enough to fill the demand? And so when we think about increasing access, you really need then that technology component to layer in that data to tell you how long is the wait time? Is it getting too long? Okay, what do we need to do to then augment that? Otherwise you're flying a bit blind and we end up in the situation we're in now.
And let's not forget, like, the member preferences and member choice and therapeutic match, right? Because how much waste is happening in the system when people show up to that first appointment only to realize that, well, gosh, I wanted a female to speak with, or I wanted somebody who maybe has a lived experience with children that, and that might be my preference, but not somebody else's. So.
And I think we've been talking about different kinds of technology here, and maybe it's helpful to take a step back and even just outline that a little bit, right? Like we're talking a lot about the technology that underpins some of these solutions. So how do we have the right data to make availability actually a true thing, to actually be available? How do we have technology that helps people schedule and book? But then I think there's also the technology of actually having the session, which is what you speak to. And I think there's again this sort of double-edged sword, right? We have then much broader access to your point. Like, what if you're looking for a provider who identifies as part of the LGBTQ community and you live in a really rural location where that provider just doesn't exist, right? Beautiful, beautiful use case of how technology can then open up access that you could see someone, within your state, because we still have state licensing requirements. Another topic for another time, but you could see someone that actually really might meet that need that otherwise just 100% would not have been available to you. So I think that's one of the most, and we hear that very often in like the stories and what people are requesting from us, and the ability to meet that need is so incredible, whereas before you would have said, sorry, good luck, which is just not an acceptable answer. But then there's also this piece about like what happens in the session. But do you want to add to that?
Yeah, I was just going to say it takes the finite supply that you have and makes it more scalable. I mean, we all have experiences, probably online shopping, I'm going to guess, and just like when you think about the supply chain for goods and services and getting that personalization, like why is it any different in healthcare? It shouldn't be.
Yeah, exactly. And as we talk about the personalization, a question that we get a lot, less and less often, is like, does telehealth work for kids, right? And I think this question was being asked 4 years ago, does telehealth work for adults? I think we can roundly say, absolutely it works for adults. I mean, we've seen post-COVID, are we post-COVID? Whatever COVID-related era we're in now, right? Like, telehealth visits have continued to go up for mental health. Like, people do not want to go back into the clinic. I have lots of psychologist friends who, like, they've given up their offices and they want to go back to the office. None of their clients, none of their patients want to go back to the office. So I think we've seen really resoundingly that telehealth really works for adults, but we do get this question a lot about, what about for kids? How does this actually work? And so I talk about this a lot with my team, and we've seen a few interesting themes. One is like the convenience factor we've talked about, but the other is the rapport building. And I heard a really beautiful story from one of our therapists recently who was like, my kiddo, they were so nervous to start therapy. They were really anxious. And so he gave me a tour of his house. Like, that was the way he started to feel safe and secure in this relationship. Like, he took the little computer around and he was like, this is my bedroom. This is where I sleep. Like, and suddenly you build this relationship that the kid has the comfort in their own home. It's certainly not true for everyone. There are people who still want that in-person setting. But it was a beautiful reminder to me of like the difference that a setting can make. And if a child really feels safe and secure in their home, which hopefully they do, then they can feel more comfort just being there and then being on video with their therapist. So there's also a couple of other interesting examples that have come up of like the therapist actually learning something that they wouldn't have learned if you were in person. So I always thought about this. I don't do clinical practice anymore, but like you hear from your client. They're like, this is what's going on. You're like, what are all the other pieces that are going on in your life that I don't have visibility into that could tell me something really meaningful and interesting about your presentation or what's going on with you? And when you are zooming in to their home, you get a lot of contextual information. You get a sense of like, what does their room look like? What is the house set up? Like, what's going on in the background? You learn an incredible amount about this kid's context. And when you're thinking about treatment for children, that context matters so much, like even more than it does for adults. And so the visibility you get is sort of like this unexpected benefit of telehealth that we hear from our clinicians very often of, I learned so much more and I could do something different and better with treatment because of it.
I love that. I hadn't heard that yet, the like I can see into the home and what that child's surroundings are like.
Yeah, and it's interesting too the other ways that telehealth has to be tailored. So one of the big evidence-based treatments for anxiety is exposure therapy, which is like if you have a fear of a spider, I'll show you a picture of a spider. We might have a plastic spider over here. Like, how do you do that over telehealth has been this really big question. And sometimes it's really hard, and I think there are some higher acuity cases that you need in person, but our team just put together this fantastic list of like virtual exposures, and it can kind of become fun with the kids, like, okay, how do we do this together? Like, what do you have in your house? And it's just a really different way of doing care sometimes, but it has translated so much better than I thought it would. Ironic for someone who works in technology, I'm like a little bit of a Luddite and a little bit of a skeptic, but it actually translates better than I thought it would.
I also have a fear of spiders, so is that
we'll talk about that
later. Okay. Maybe another area we could go into, because again, from like the health plan side of things. When we think about technology, we're constantly thinking about how to integrate experiences people might have with other platforms or other provider solutions, especially since virtual health, mental health specifically, is such a growing area that there is an opportunity now to have a more connected experience. So as you're building your solution, thinking about APIs that might be available to, again, route things like availability and member match, because the reality is like that first stop for a member might be their health plan's provider search site, and we know that that's where like people tend to get tripped up. And so then when they might have to actually drop to a phone call and they don't want to do that.
Yeah, I think it's a great question. I think mental health is somewhat unique in that being there in the moment when someone's ready to get help, there's unfortunately still so much stigma around mental health care. So when someone is ready to take that step and say, hey, I need help, I'm ready to get help, like how do you make it really easy in that moment, but also acknowledge that that moment might not be when you expect it. And so how do you be in as many places at once as possible. So like being in the health plan directory, like we see that being a huge place that people go. How do you get presence in schools? I think it's about like showing up in the places that really matter, and maybe YouTube is what I'm hearing?
YouTube, for sure. I think also like pulling some pieces of assessment through, because the other side of the coin is I might not know what my child even needs or where to start. Like, you know, gosh, should I be concerned that my child has this like affection towards YouTube, which is the gateway drug to Facebook? Which, you know, do they need coaching? Like how that emotional resilience that they're building? Do I need coaching or do I need therapy? Like how we're able to help somebody assess what it is they might be needing, because it's a whole lot more difficult to pinpoint that when it's a mental health situation versus my child just fell off their scooter and I can tell we need to go to the ER because we've got a broken arm.
Yeah, I think that's such a good question. And I think we still put this expectation on people that somehow they should know what they need, and somehow they should know how to find it. Like, I'm a psychologist, my kiddo's only 1, so we're not looking for a therapist yet, but like, I would even have a hard time thinking about like, what is it that she needs, and how do I find that? And so I'm pretty deeply in the field. If I would have a hard time doing that, how do we think about that across populations, particularly when it comes to health equity, mental health literacy? And so I think it really is about like, how do we help people understand even what the options are? And I think that's a great example of a use of technology. Like, we are all, I don't know, is anyone else a sucker for like the Instagram quizzes that they give you? Like, I'm a total sucker for those. Like, what if we used those in a way that actually was an evidence-based questionnaire and actually led people to a pathway that tells them a little bit about what they need? And that, in and of itself, I think, breaks down the stigma. Because if suddenly it's not just like, oh, my child needs therapy, but like, oh, my kid's in therapy, my kid's in coaching, we're doing meditation over here, suddenly it's become everyone needs something, which I think is completely true.
And you just hit on something. I'm going to call him out, and he's going to smile. Dr. Ngati and I were chatting earlier about the paradox of social media and the challenges, and how you know, we have all of these great apps being born in the mental health space. And he said, well, how do we meet people where they are? Like, how do we integrate these experiences into the apps that they're already using, those viral places that they're connecting? Like, what is the role and the responsibility that these technology advancements in social media have on responsibilities for curating? Like, how do we change the algorithms of what the content that's being shared and consumed?
If we have anyone building the algorithms, please talk to us afterwards. But I think it raises this really interesting question, Jen, of I think we're at the very beginning of the frontier of understanding how technology can be helpful, because it still is, like, healthcare tech is separate from other areas. So with the caveat that I said earlier of like, I don't think we should have monthly active users being our North Star, but what are the things that we can learn from those other fields? This is something I talk about. There's more and more psychologists and other therapists and clinicians moving into tech, and we have a lot of these conversations about like, what is the right balance, right? Like, we have these beautiful evidence-based interventions, 12 sessions, we were just talking outside about cognitive processing therapy for trauma, incredibly effective treatment, but not everyone gets it. Not everyone else gets those 12 sessions. So how rigidly should we hold to this, it must be 12 sessions of evidence-based care for everyone? Or can we pull out pieces of that to say, here's actually a really useful tool or principle that whether you are sort of in a more acute phase or you're just a person living in the world, because frankly that can be pretty hard sometimes, these are tools and skills that can be really helpful. And so I think there's a really interesting next step to that we haven't gotten to yet as a field of like, what does that then mean for being on TikTok, right? Like, there's therapists all over TikTok. I often hear kids be like, oh, my TikTok therapist, and the scientist and clinician in me is like, oh my gosh, like, what are you hearing? Because there's no validation, there's no sort of testing of that, there's no quality control, we don't have Jen saying, what are your metrics, what are your outcomes? But what if we did, right?
Yeah.
Like, what if there was a way to actually say, we're gonna be embedded in here, we have some way of letting consumers know, like, this is trusted content, and we're actually monitoring it. Like, I think that's sort of like the next frontier.
Yeah, well, and that's where my brain started to go next, which is, what are those like pioneering technologies that help blow this whole thing open? And there's like virtual reality coming, AI, responsibly. What are some of those examples? What you were just saying, actually, I had a recall moment around, again, my 8-year-old and her YouTube addiction. And I was sitting there watching her, and she was looking at a video where a woman was building Legos, right? This is the type of, they like to watch other people play with Barbies and build Legos. And I asked her out of curiosity, Madison, what's exciting about this to you? Like, why do you like this? And she said, well, when she's building the Legos, I feel like I'm building the Legos. And I said, we have Legos upstairs. Like, what if we actually got the Legos out and you built with Legos? And she said, Mom, that's too much work. Like, there's something about this, like, vicarious experience that you get, and that for her was the addiction. So how does, like, virtual reality was another transcendental area of technology where I think, gosh, what sort of innovation's coming there?
Yeah, it's those pesky mirror neurons that build that empathy. I mean, it's such an interesting question, and I think it gets back to that, like, what is the purpose of technology? Like, what are we building technology for? And unless you're really intentional about that up front, it is very easy to build technology in ways that become really detrimental, right? So is there a world in which we could have, like, my vision for technology that helps adults, kids alike, is like, this technology helps get you into your life and living this full and rich life. So it'd be interesting to think about, and this is where, like, my clinical and scientist brain hits a wall, but, like, partner with the product folks and say, what could we do here so that not only are you watching these Legos, but you actually get motivated to go out and do that yourself, or to meet up with a friend and you do it together and build these social ties and connection. Because we know a lot from behavioral science about motivation, right? So it's too hard. The clinician in me says, okay, what are the barriers? And let's break down those barriers. But what if we embedded that into the technology? It's like, I think there's, like, a true marriage needed between the fields a little bit more.
Like, I'll riff a product innovation right now. Like, what if YouTube said, Madison, I noticed you've watched a lot of Lego building videos. Like, what if we could bring on somebody live right now to build Legos with you? Go get your Legos, right? Like, reinstill the, actually living the life.
After the first moment of panic of, like, how did they know? Like,
I have crazy ideas sometimes. I once thought, gee, I really love fitness, and there's this, like, overlap of, like, mental well-being and your physical, and what if I was on my Peloton bike getting my exercise in, and I had my therapy session right there on my Peloton? Like, those are the types of things I think about.
I'm actually shocked that I haven't heard of anyone being on their Peloton during therapy yet. People are doing therapy while they're driving now. It's amazing how often we have to be like, please don't drive and do therapy at the same time. Like, at least pull over. But I think it brings this really interesting question again of, like, what are the things that we care about and what are the metrics that we want to track from this? And I think that's the part that we haven't necessarily figured out really well, right? Like, is it how many clicks? Is it how many pieces of content someone's using? Or is it something really different? Like, a measure of, we look at symptom reduction, which is incredibly important, but then is there this other piece about human flourishing?
Thriving.
And I think that's, like, as a healthcare field, we've been so focused on symptom reduction, which is so important because there's so many people that need it, but then we're missing this other piece about how do we help people live a life worth living.
Yeah, how do you, like, I know, and now I'm channeling, like, the employer side of things where, we measure success in innovation and point solutions as, like, well, how many people did you engage, right? The engagement. And how do you move from, and we know that engagement ties to, things that they're trying to measure around workforce productivity. And as it relates to children, gosh, that's going to manifest in a parent being distracted, absent. Their health is going to deteriorate because what's the first thing we put aside when our children are languishing? It's our own health. And so, like, how do you move from engage to metrics of inspiration, which is this ability to, show up and be happy at work every day?
Yeah, and I think that That sparked for me as well, Jen, this idea of, we were talking about prevention before, and I think there's holistically, like, people believe in prevention, right? We all believe in prevention, I'm assuming, yes. The funding doesn't tend to go towards prevention initiatives, and the metrics are really, really hard to track there, right? I'm putting in place a program that will prevent depression in the future. How long do I have to track people for? How do I measure that? And I think we can't let that be the barrier to then investing in that. I think it's about, like, how do we figure out what the metrics are? And I think about that so much more even for kids. So one of the reasons that I do the job I do is when I worked with kids before, you see this like spark of understanding happening. I worked with this, when she was 17, she was about to go off to college, we were doing acceptance and commitment therapy, and she was a sponge. And she was soaking up these principles that, like, I didn't learn until I was in graduate school. Most adults haven't learned. Like, if even a nugget of this stays with her as she goes through her life, like, how does that change her life? How does that prevent depression from occurring? I'm a cognitive behaviorist, so it's like, right? It's like thoughts, behaviors, and emotions. We don't learn what those are. And so there's this really, I think, compelling argument to make for prevention for kids in particular, but we have to shift away from the mindset that somehow the reward is going to be tomorrow or the next day, but how are we setting kids up for a lifetime where, as technology plays its sort of dangerous role over here, they have the skills and tools to manage that so that we don't have the rise in depression, anxiety, suicidality. Because I often think about this, we have these staggering rates and we get this question all the time, why? Why are children so depressed and anxious? Like, how could they not be, right? Like, we live in a very scary world. There are crises happening all the time. It's hard for us to navigate as adults, and we're expecting kids to go through the world and somehow know how to make sense of things that we can't make sense of. And so I think this is another role technology can play, is giving people those tools and those skills. How do we help them learn that early on? And then how do we make the case for it? Because it always comes down to, like, what is the ROI, and how do we tell that story in a convincing enough way that there is that widespread adoption? Yeah. I'm curious how you all think about that on the health plan side in terms of the ROI of prevention or of kids and youth mental health.
You're right, like the how do you measure it, and then how do you prove it, and the availability of the data to actually do that with conviction, right, with the right data science models. I'm looking at the clock. I'm distracted because I feel like right now I have the potential to move from asset to liability, so I don't know if we open it up to questions, yes. Or like we had talked about, and everybody who's sitting in their chairs right now is like, gosh, why didn't I get up when everybody else left the room? We were like, well, what if we flipped this whole session on its side and started asking the audience questions? We won't do that to you.
Maybe a little.
Maybe a little? Okay.
Maybe a little.
Maybe like voting, yeah, so that they don't have to hand the mics around. Yeah. We want to take a couple
yeah, we would
questions?
love to open it up to questions.
Oh, we have one.
Yes.
How would you say the role of schools comes into play, like what their responsibility is or resources to be able to then introduce this in their educational practice as well?
So I'll repeat the question in case folks couldn't hear. What is the role of schools in addressing this crisis? I summarized briefly. So I would love to hear your take on this, but I think there's multiple levels of intervention and role that a school can play. Thinking about that broadest spectrum again of prevention, kids go to school to learn, right? So learning socio-emotional skills, learning all these tools and skills, I think being like a standard part of what's offered. We know, though, that schools are really strapped for time, they're really strapped for resources, and so are there opportunities to weave in really engaging sort of digital curricula, coaching, et cetera, to give this broad skill set that I think every kid should graduate with. Like, this should be a fundamental tool that we send you out into the world with. Then I think there's this level of, like, when someone is in that higher acuity need, they have a need for clinical services. Often schools have one counselor for the entire school. How, like, that just doesn't make sense with the level of need that we're seeing. So I think it's about how do we, as innovators in the space, think about supporting schools in helping those kids. So whether that's adding on augmentative support from like a therapy perspective, more access to providers, but I think then there's like a how do you integrate really well with the schools so that there's really nice referrals. So the school understands, like, here's who our counselor is best at seeing, here's when we want to refer out, and then how do we facilitate that referral? A surprisingly big issue that comes up for us is, like, folks like, I want to do therapy after school. And that makes sense, right? You don't want to pull your kid out of school, but how do we help? Like, that's just not scalable from a supply-demand perspective. Therapists aren't all going to work in the evenings and at night, and your kid is really tired at the end of the day. But I think there's more work that can be done with the school to say, how do we help the school understand, and how does the school reinforce that this is actually equally important to this class that you're in, and it is worth you stepping out for an hour to do your therapy session. That's going to be equally valuable or more valuable. And then how do you have a space set aside where people could go and do a therapy session where there's not stigma around it, you're not being pulled out of the classroom. So I think a lot about how do we support schools and having enough resources, but then how can the school help facilitate people actually taking advantage of those resources and making it normal and okay. And not just normal and okay, but actually like celebrated and central to what you're doing, that you actually can engage in those services when they are available. Curious your thoughts, Jen.
Yeah, no, like I'm trying to like jump back into the ecosystem, because where I was thinking was like one of two ways, which is how do you deplete the burden of an eligibility check in where that school is referring to people, or how do you liberalize the service in a way where you don't even need that? And I know because with on the health plan side, we have clients that are school systems, and that becomes an area where you can dive in a little bit deeper, and you might have more control to bring those programs like into the school setting. But then like beyond that, I also thought what Brightline's doing in the state of California is another example where like all of those schools should be up to speed on the services you have to offer to get people routed, because that is a liberalized.
I promise I didn't ask Jen to say that, but I will give a little bit of a glimpse. The state of California is making this unprecedented investment in youth behavioral health, the California Youth Behavioral Health Initiative, of which Brightline gets to play one small part. So they're making coaching and digital services free for every family in California with a kid age 0 to 25. Like, it is an incredible investment, and it takes away all these barriers. So the schools can say, you're struggling, literally, here's the link, and have free coaching, free digital services. So there's, I think, those types of like really rethinking how do we even make this accessible takes away all of those barriers you were mentioning, Jen.
Yeah.
More questions?
So I'll take the state example, because this is one area where we are leaning in right now with Brightline, which is how do we, for employers we know are situated with large concentrations of membership in the states, when we have, whether it's through prediction or prevention, that can become an explicit referral source. Like, how can we outbound get people into programs like Brightline, that we know that there's not going to be that barrier to out of pocket or coverage. So that's one area where we're exploring. And then health system overall, we do spend a lot of time with our employers exploring their unmet needs. What are the populations that are really struggling? We make sure that our network has, the full complement of specialty services that are needed. We know with youth and adolescents, like, that is a big growing area. We were really excited to have one of the early adopter relationships with Brightline to be able to bring a different response for that population. And then, we also, within the Medicaid area, stepping outside of employers, again, virtual mental health, like, how can we get on the cutting edge and make sure that, impoverished populations or more vulnerable populations are getting access to care that they need, regardless of the out-of-pocket.
Yeah, I fully agree with all of those pieces. The other things I think about with health systems is screening. So the United States Prevention Services Task Force put out that recommendation to do screening for kids for anxiety and depression. And I think that's, from a public health perspective, absolutely critical. So I think a big role health systems play is doing that screening, making that really consistent across primary care, across basically any level of services. I spent a lot of time working in health psychology, and we know if a kiddo is receiving healthcare services, they also have a likelihood of having mental health concerns associated. So I think that universal screening piece, I think what scares health systems, frankly, about doing that is like, okay, now I've screened. I have this kid in my office who I know has screened positive for anxiety or depression. Where do I send them? And so I think having that referral source and making sure there's a close connection in that direction is really important. The other way I think about that is in reverse. So if a child is hospitalized for a mental health reason, maybe they've gone to the ER for suicidal thoughts or panic attacks. Unfortunately, usually it's stabilized and then good luck. Back into the community, I hope you find services, maybe try for an IOP, and people are like, what is an IOP, what should I be looking for? And so that step down piece I think is really critical. Like when someone is being discharged from the hospital, what is that service that you are discharging them into? And I think with what we've learned in the last 4 years now of doing telehealth is that telehealth can actually do a lot more for that population than we thought. I think there's this sort of mental block that people have of like, well, that's really high acuity, so find something in the community. But I actually think there's a ton more that can be done for that population through telehealth than we thought was possible 4 years ago, and we didn't have the data 4 years ago, and now we do. So I think that step down can be made a lot smoother because a lot of kiddos are falling through the cracks there.
And that is a big part of what we offer with our case and condition management. And we have some quality partnerships with different facilities that we work very closely with in that. So that's good.
Great questions. I think we have time for one or two more. Yes.
You mentioned early on the rates of suicidality among youth. Could you provide some context around how you plan to address this, maybe with the coaching program in California or in partnership with Altman?
Yeah, so I think, so the question was, given the alarming rates of suicidal ideation with youth, like how we plan to address that. And I think the reality is that it has to be multi-pronged, right? So no one solution is going to be the full solution for that spectrum. The way we think about it at Brightline, and I'm really curious to hear how you think about this, Jen, with Aetna, so is our role there and with the state of California is really helping to get people, if they are at that true crisis state, to the services that are going to be really appropriate. I think it's incredibly important clinically to make sure that we are staying within the bounds of what we are really good at doing. We are not a crisis service, and so we cannot be that in-the-moment support for people. But there are incredible organizations that can be that in-the-moment support for people. And so I think our role in that is really helping people understand what their risk is, because it is terrifying as a parent if your kid mentions anything related to self-harm, to suicide, right? Like, that is the scariest thing. And so what we can help really do is help people understand what is that level of risk. Is this something that truly, like, yes, get to 988, get to an emergency room, crisis text line, like, immediately? Or is this something that actually is lower acuity? Let's do some safety planning. Let's get you into therapy and manage it in a more long-term way. So I think helping people understand and like what is this level of risk, and helping disabuse some of the myths out there of like, don't talk about it, don't ask about it, you'll plant the seed. Absolutely not true. It's the opposite. Ask about it, talk about it. You will not somehow plant the seed for someone that wasn't thinking of that already. And so I think it's about that upfront screening and then making sure people are getting to that right service level, and then consistent safety planning and having those resources on hand. Curious, Jen, how you think about it?
Well, on the Aetna side, I mean, we had a bold goal to reduce suicide by 25% by 2025. And had great success with adult populations. And I mentioned earlier the power of prediction. We developed a predictive model for at-risk, high-risk youth and adolescents, and we have an outbound outreach program that has now reached 400 families. So we reach into whether it's the parent, might be a caregiver, to make sure that we are ahead of what we think might be that sad outcome, getting people routed to resources that can help.
One more question? We squeeze in one more?
Oh, yeah.
So early on we mentioned about what role tech is playing in mental health. We discussed access, whether that's probably nothing I don't have much time. But is there any other items worth mentioning? What role tech plays in child mental health?
So I think the biggest for me are access and quality, like more consistent quality, higher quality on the positive side. We've obviously talked about like the scary negative side, but I would say access and quality are the two headline items for me. And then there's probably this third level that we haven't yet scraped the surface of like truly the integration, but really making sure that people have access to care and that it's high quality.
Yeah, and like we on the health system side, we're like really trying to crack this navigation nut. Because we don't necessarily know where the member's gonna hit us or where they're gonna try to figure things out. So there are a lot of great innovations coming out with like anonymous peer support and beyond the hey you have a coach or hey you have a therapist, like hey you have this entirely other way to seek support, and maybe it's buddying up with a peer who's had a similar lived experience as you, and maybe that's what you need in addition to whatever else you're getting. So we think about navigation and then what other wraparound opportunities are there. We also look at social determinants of health and other underlying factors that may be contributing to, especially when we think about child, it could be a symptom of maybe a home that's in distress because, both parents are out of work, or a single parent family, financial distress. So what are ways we can also infuse other types of resources to help? So it really is navigation and other wraparound services that could be offered through technology.
I think we're getting our virtual
We're gonna get
usher off
dragged off.
music.
Does anyone want me to end with a song?
Absolutely.
I've
You
done enough.
offered. Thank you all so much. Really appreciate it.